Okay, this chapter is talking about development of tumors or neoplasms. And the first thing we're going to talk about is some tumor nomenclature. So there's three roots that I have here, and LIP or LIPE refers to fatty tissue. Adeno is the term for glandular tissue, and, and fibro refers to fibrous tissue. And three suffixes. Oma means benign, carcinoma refers to malignant epithelial tissue, and sarcoma is the term for malignant tumor of fibrous tissue. So, you can put some of these together. Lipoma, benign tumor of fatty tissue. Adenocarcinoma means malignant tumor of epithelial lining of a gland, and fibrosarcoma is malignant tumor of fibrous tissue. Now, characteristics of benign and malignant tumors. Benign tumors usually consist of differentiated cells that reproduce at a higher rate than normal. The benign tumor is also often encapsulated and expands but does not spread. Tissue damage results from compression of adjacent structures like a blood vessel. A benign tumor is generally not life-threatening unless it's in an area such as the brain where the pressure effect can become critical. Malignant tumors, however, are often undifferentiated and non-functional cells. They divide rapidly and spread into surrounding tissue. The term oncology means that it refers to the study of malignant tumors. Now, here's a picture showing you cancerous tissue, and the one on the left is a benign breast tumor. That tan region at the top is an encapsulated tumor. And on the right, you see malignant breast tumor. This is infected tissue that is actually spreading out roots and invading surrounding tissue. The pathophysiology of malignant tumors. These are often large, space-occupying masses, which leads to necrosis of tissue and inflammation. Malignant cells tend to break loose from the mass and infiltrate into adjacent tissues. Some neoplasms develop quickly while others remain in a pre-invasive state of cancer, which is known as in situ, for months to years. For example, cervical cancer is slow growing and regular checkups can offer an excellent chance for recovery. Warning signs of cancer. This is a list, some of the things that may indicate that something's going on. Unusual bleeding or discharge anywhere in the body, change in bowel or bladder habits, a change in a wart or a mole, a sore that doesn't heal, unexplained weight loss, anemia or low hemoglobin count and persistent fatigue, a solid lump, while often painless in the breast or testes or anywhere for that matter. Local effects of tumors. Pain is not usually an early symptom of cancer. It generally occurs when the tumor is well advanced. Obstruction can result when a tumor compresses a duct or passageway from an external position or grown inside a passageway or around a structure. Tissue necrosis and ulceration may lead to infection around the tumor. And this is showing you here a tumor that is pressing on a primary bronchial passageway and can affect airflow going into a lung. Different types of tumors associated with the colon. This is a circumferential tumor that may reduce the amount of space for feces to get through. External mass pressing on the tumor, pressing on the colon from the outside. And this is a polypoid tumor, which is also a polyp. Usually epithelial polyps arise from proliferative dysplasia, and they're also called adenomas. Systemic effects of tumors, weight loss, and severe tissue wasting in many malignancies. Anemia, low hemoglobin from anorexia, leads to fatigue and poor tissue regeneration. Infections such as pneumonia from decreased host resistance. Bleeding may occur. Tumor cells erode blood vessels or cause tissue ulceration. Bone marrow depression may contribute to poor clotting. Chronic blood loss leads to iron deficiency anemia. Paraneoplastic syndrome, additional problems associated with certain tumors. Certain tumors will produce hormones that act just like the hormones that you would produce from endocrine glands, and they can kind of throw off a detection of the cancer. Um, and these can interfere with bodily functions too. Tests used for diagnosis of cancer: blood test. You can check hemoglobin, white blood cell count, white blood cell differential. Hemoglobin and red blood cells tend to be lower in cancer. Tumor markers are substances produced by some malignant cells circulating in the blood or other body fluids. So some examples are carcinoembryonic antigen, which is the marker for colon cancer; human chorionic gonadotropin, which is the marker for testicular cancer; and prostate-specific antigen for prostate cancer. There's also CA125 for ovarian cancer, but a lot of cancers do have tumor markers. X-ray, ultrasound, MRI, CAT scans examine changes in tissues or organs. Cytologic tests: you can take biopsies of specific tissues and look for atypical or cancerous cells. Spread of malignant tumors. What happens is normally you have the invasion, refers to the local spread where the tumor cells grow into adjacent tissue, destroying normal cells. Metastasis is a spread to distant sites by blood or lymph. Lymph nodes are also common secondary cancer sites, as well as the lungs and the liver. Seeding is the spread of cancer cells by body fluids or along membranes into body cavities. For example, pelvic inflammatory disease by the peritoneal membrane. So this is a picture showing you invasive carcinoma of the cervix. Here's non-invasive. It's encapsulated. It's at the base of the cervix. And you can see a picture here where the cells are different, but they are contained within the tissue. The basement membrane is intact. When you go to the invasive form, now the basement membrane has been broken through, and in this picture it's gone into the vagina. And then eventually, as time goes on, you get the cancer spreading into the bladder and into the rectum, and that's widespread invasion. This is metastatic breast cancer. So it's showing you the primary tumor, and the primary tumor cells can break away and travel by the lymphatic system, lymph vessels, or through the circulation through a vein. And with the lymphatic distribution, they go to the lymph node, and they can set up shop there. Secondary cancer sites, remember, are primarily lymph nodes. Then break away and go through lymphatic ducts. Here, through the circulation, through the venous circulation, they can go to other places in the body where they can find a capillary bed that may allow them to stay. And then the secondary tumor grows and spreads. And then eventually you get multiple tumors in particular organs. In this case, they're showing you the lungs. Now, in this case, this is looking at breast cancer. That's where the primary cancer is. And then because the axillary lymph nodes are nearby, very easily spread through a lymphatic vessel to axillary lymph nodes, and then through the lymphatic circulation to the vena cava, and then going into the lungs, nice secondary cancer site. The aorta carries the tumor cells from the lungs to all organs, and you can go into ovary metastasis, brain metastasis. So many times when people have cancer for a long period of time, you will see where various organs are affected, and even getting into bone marrow and other places. So that's the pathway of metastasis. This is a picture of the liver with multiple metastatic tumors. Really appetizing, isn't it? This is ovarian cancer spread by seeding. Now remember that the abdominal organs and pelvic organs have a serous membrane that's known as the peritoneum. Now the peritoneum has blood vessels going through it. It has arteries, it has veins, and to provide circulations to the various organs. And so you do have, in the case of something like a primary ovarian tumor, starts here, and because of the continuous peritoneal membrane, here's your seeding in the intestines, and then eventually going up into the stomach, the liver, other organs, contained in that cavity. So that's seeding. Carcinogenesis is the process by which normal cells are transformed into cancer cells. Stages in carcinogenesis have been organized into these next bullets here. So the first thing is initiating factors, factors that are going to cause irreversible mutation of DNA. Genetic factors or exposure to environmental risk. Now, repeated exposure to carcinogens causes further changes in DNA. And this could be hormones, could be cigarettes, viruses, and at this point you could have dysplasia or anaplasia being evident in the cells themselves. Continued exposure or changes in DNA result in malignant tumor, and so as time goes on, the multiplying of these effects of exposure over time will lead to damage that will result in malignancy. Now this picture is putting together the causes, okay, so these are your risk factors, and then the process of DNA alteration, and then what's going on in the cell, the changes that will result in malignancy. Here's the risk factors. Could be genetic factors like oncogenes. Like in breast cancer, there was certain genes picked out that are oncogenes. Viruses, there are oncogenic viruses, for example, hepatitis, human papillomavirus. There's certain strains of that virus associated with cervical cancer. Radiation, UV radiation, increases in UV radiation leads to skin cancer. Chemical agents, like for example, with lung cancer, exposure to asbestos and nickel can increase lung cancer. Leukemia, solvents such as benzene are something that benzene is a carcinogen that could lead to leukemia. Bladder cancer, rubber, exposure to rubber, aniline dyes. So those are examples of chemical agents. Biological factors that could result in chronic irritation and inflammation with increased mitosis. For example, colon cancer from ulcerative colitis. Age. Many cancers are more common in older people. And one of the reasons is because the compilation of many exposures over years results just naturally in alteration in DNA over time. Diet, natural substances, additives, or processing methods. It's been shown that a high-fat diet could lead to colon cancer. Hormones, for example, endometrial cancer being associated with high levels of estrogen. So types of therapy. So treatment involves surgery, chemotherapy, radiation, or a combination depending upon the cancer. So radiation effectively destroys rapidly dividing cells, but also rapidly dividing normal cells. And that's why you see some of the side effects with people that are on radiation or chemo. Bone marrow depression, epithelial cell damage, abdominal radiation may cause sterility. Produces a non-specific fatigue and lethargy and accompanied by mental depression. Chemotherapy, anti-neoplastic drugs. Not all cells respond to this type of therapy. These drugs target cells at different points of the cell cycle. Adriamycin is an antibiotic that acts on cells undergoing DNA synthesis. Vinblastine is an antibiotic drug that acts in cells in mitosis. Bleomycin damages DNA. Dacarbazine, nonspecific drugs acting at several points of the cell cycle. Side effects of chemotherapy may depress bone marrow, which could lead to a multitude of problems. Also, hair loss, nausea, vomiting, etc. So this is showing you the effects of treatment on a solid tumor. So if you look at this picture, here's your tumor, and it's showing you over time the number of malignant cells, relative number, and the size is just as it gets bigger, more cells are present. Tumor growth starts off with signs appearing, maybe not specific, and then hopefully diagnosed early enough where you can introduce treatment, excise the tumor if it's encapsulated, and possibly follow up with chemo and radiation and lead to a cure. Um, Radiation, chemotherapy here, and then if it resists treatment and it continues to grow, then over time, maybe late intervention may lead to a cure, but it could recur. And then, if nothing helps, widespread metastasis could lead to death. And that's kind of the way it progresses. Just an overview of the different possibilities of treatment.